All right, team, are you ready? More than the audience, I'm worried about the team. So why? So, so while we were wondering, while looking at other presentations, oh my God, have we done anything? Let me assure you, we have done a lot more. Yes. So hello everyone. This was a pharma R&D table, and we worked together, debated, deliberated, and here are some findings. So this is a brief summary. We were 5, one of us had to leave early. So 4 of us, what's that? He was not agreeing, so we kicked him out. Yeah. So lot of things were discussed. I mean, as you've seen, we just looking at the slides with all of you. But I know what happened at the table, so I'll try to do some summary of this. So largely the idea was, what kind of AI policy do we have or do we need in able to use AI in pharma R&D in a good way? And then we were tasked with a sort of a project that in 18 months, we were different expertise at the table and different companies. So what we can do together meaningfully. And that was the 18-month project. So some of us were not comfortable sharing the company name or their name, and therefore it's anonymous. But nevertheless, the discussion was fruitful. So in 18 months, we thought it's possible to deploy a AI accelerated clinical trial pilot program, and primarily with predictive analysis, because that's the power of computing. And we had 2 companies who can provide data. We have 2 consulting companies or service who can analyze the data. So again, 3 to 1 is the convergence of protocol in sandbox, AI credibility, governance, unity. So same thing, that there is lot to do for policy to converge together. Our recommendations, number 1 recommendation is establish a national AI in drug development regulatory sandbox and federal learning consortium. And this is something I know that last year FDA came up with a guidance, actually, use of AI. And earlier this year in 26, FDA and EMA came up with a joint guidance for some of the use. And I thought we as a country can learn from it. And that's why it need not be a state level thing. It has to be a country level thing, where we have some structured framework where we can have some guidance. So that's why it has a strong majority. Consensus level, strong majority for conversion. Priority is high because, I mean, AI is moving so fast that last week is already outdated. And that's why the summary statement is India should create a CDSO anchored regulatory sandbox where AI methods drug development can be tested. So establish that credibility, and once we have a guidance, then everybody plays by the same rules. What we actually wrote, pilot AI-powered clinical trial, he left Varun, trusted data ecosystem, there should be a clear regulatory framework with human in the loop, with trust and quality. This is anonymous, so I'll not say your name, Sonali. Yes, but a stringent framework with a PPP model is needed. AIG, oncology, best fit networks, and then concept. So there was also interesting question about who gets the IP actually, how should that be governed? And this is what I wrote, that the concept originator and payer for that research should keep the IP. That's how it works in any world, but more so in pharma world. And how should we leverage it? There should be review methods, we should validate, because end of the day, pharma industry is the most regulated industry. We are dealing with lives, right? And there is no room for error. This has been said before, there has to be a human in loop when we validate, there is a hallucination and all those things. So, what is the biggest constraint? The data. What I mean by data is there is lot of data, but the good quality data. There is lot of noise. especially in India, there is no organized way, there is not one fixed format of collecting data, and that just leads to a lot more noise actually. There are also policy gaps, there is economic impact, social impact. So again, we considered a lot of these things. I know in interest of time, I'll not go through this, and Shriram said they'll share the slides as well. So this is something AI did based on our input, I guess. And this is a score on these flagship mission alignments: Vikasit Bharat, Digital India, India Mission, Startup India, Skill India. So largely there is a lot of alignment. On some of these things, looks like there is less alignment, but that's what AI did. Looks like our suggestions or recommendations, or at least deliberations, also strongly fit with Niti's frontier track and responsibility of AI agenda. So that's good to know that we are already aligned in some way. State readiness, Telangana, not surprisingly, is ranked #1 in this actually. And in the morning, whoever there for the minister's talk, this is not the first time I heard him, but even today it was very encouraging that they are very supportive, encourative, very bullish on these things to make it a really strong ecosystem. And he clearly says, I'm not a technology guy, and yet he's so supportive and pushing to do the right thing at the right time. So it's not surprising. What do we need to do 0 to 12 months, like short term, mid term, and long term? CDSO needs to come up, like, come together and issue some draft AI credibility guideline, then involve experts from various areas. In midterm, then the pilot, I mean, there are a lot of pilot happenings, but maybe a collaborative from experts from various different institutes and things like that. And then that's why the pharma consortium, where we'll have people from, like similarly like earlier, industry, academia, government, startup, patient advisory groups. And then that will automatically pave the way for long-term paths. Who leads what? Again, some of these central government agencies will have to take participation and support. So we were very bullish on the stringent PPP framework actually, the public-private framework. So again, these are some of the common partners along with what ma'am had suggested earlier, which makes sense. I myself been part of like at least 100 clinical trials at Novartis in the days. And we always used to have a patient advocate also when it went for discussion. It also has some impact on GDP and employment and other things. Classification of national program. Like I said, this affects the entire nation, not limited to Telangana. It has to be looked at a national level. This is pretty much a summary. Any questions on pharma R&D? I think that's the last slide. Yes.